ladies. Have you ever felt like your menstrual cycles are worse than they should be? Have you or someone you know been diagnosed with fibroids and you want to find out more? Do you spend ages researching your symptoms online but wish you could get more relatable information? If you are frustrated with dealing with fibroids, watching this video will solve that. In this video, you're going to learn about uterine fibroids, what they are, how common they are, common and rare symptoms they can cause, and what options women have when they are diagnosed with fibroids. By the end of this video, you'll know a lot more about fibroids than you would know from your online search. In the next 10 minutes or so, you're going to hear my professional answers to questions asked by women in the office. First, let me introduce myself. My name is Dr. Siobhan Joseph, and I'm a board-certified obstetrician and gynecologist. This monthly series is called You Ask Doc About. And every month I'll present answers and explanations to questions asked by women I have seen in my office. All women will benefit from watching this series. You'll get interesting facts you never knew, like later in this video when I discuss reasons why you may not want to have surgery. This is for informational purposes only. For medical advice or diagnosis, consult a professional. First, here are some fast fibroid facts. Uterine fibroids are the most common benign tumors of the female reproductive system, occurring in 20 to 30% of females, most often in women aged 30 to 50. Globally, women aged 35 to 39 years or older had a higher incidence of uterine fibroids than younger women. So fibroids account for almost 1/3 of hospitalizations in women aged 15 to 54 for gynecological conditions. Hysterectomies, or removal of the woman's uterus due to uterine fibroids, account for 40 to 60% of all hysterectomies. We do know that menopause is the only time in a woman's life when fibroids will naturally stop growing and gradually shrink over time. Lastly, the annual economic loss caused by uterine fibroids in the United States was higher than the total treatment costs of breast, colon, and ovarian cancers. Family history, genetics. What's race got to do with it? Let's talk about our Caribbean ladies. Research indicates that women of African descent in the Caribbean experience a significantly higher rate of fibroids compared to other ethnicities. Afro-Caribbean women may also tend to develop fibroids at a younger age compared to other populations. Studies suggest that fibroids in Afro-Caribbean women might be more aggressive and present with larger sizes. If multiple women in your family have fibroids, you have a higher likelihood of also having them. Research shows a genetic component to uterine fibroids. So if your mother or sister has fibroids, your risk of developing them is significantly higher than the general population. This knowledge means that young girls and women with more severe menstrual symptoms than usual and/or with family histories of fibroids can have earlier screening to identify fibroids when they are small and easier to manage. So, question number 1, let's dive in. What are fibroids? This is a common question both online and in the office. Fibroids are non-cancerous growths that develop in or around the womb or the uterus. The growths are made up of muscle and fibrous tissue and vary in size. So fibroids are basically aberrant smooth muscle cells and connective tissue that grow into these ball-shaped tumors of various sizes and locations. They feel very rubbery and firm, somewhat like a tennis ball, and as a result, they do carry some weight to them. Many fibroid symptoms are due to the disruption of the normal functions of the uterus. Question number 2. Are my symptoms normal? Don't worry, you're not crazy. Fibroids can cause a long list of common and unusual symptoms. They can vary so much in the number, size, and location that many women will experience symptoms some others may not. About 1 out of 3 women, however, will have symptoms. In many cases, some women do not experience symptoms, at least until there's been sufficient growth and changes with their fibroids over time. Women with pain as their main symptom experience abdominal and pelvic pain, pain during sexual intercourse, which is important because it's often a deep pelvic pain, but not pain with penetration. Pain with sex can worsen in different sexual positions, and painful sex is described by 1 in 5 women with fibroids. Lower back pain is another symptom experienced as well. And of course, painful periods are a very common experience for women with fibroids. Constipation, which can be so severe it may cause significant abdominal pain, can happen as well. Uterine fibroids may also cause abdominal pressure and bloating, frequent urination, heavy periods, anemia, and abnormal bleeding patterns. Pain symptoms will usually depend on the size and location of your fibroid or fibroids. Some women experience intense pain in the exact area where the fibroid is located, and some just have a general chronic pelvic pain that is described as dull aches and cramps. Fibroids can cause significant pressure on the bladder or abdomen, also causing discomfort even when you're not having a period or menstrual bleeding. A less common symptom caused by fibroids growing near the back of the uterus, where it can press on the nerves of what we call the lumbosacral plexus, a network of nerves that supply feeling to your lower limbs and all throughout your pelvis. This pressure causes constant leg and lower back pain and pressure that often becomes worse with movement. This is similar to nerve pain experienced by women during the 3rd trimester of a pregnancy. The bigger fibroids become, the more uncomfortable they are. While not considered a common pain symptom, sciatica and hip pain can be related to fibroids. Some fibroids are what we know as pedunculated fibroids. Now, these lines are connected to the uterus by a branch-like piece of tissue. So they're on the outside attached by a stalk. In severe cases, twisting of this branch or stalk that a fibroid is growing off can cause extreme pain, usually requiring some form of urgent care because it blocks the blood vessels supplying the tumor. This type of fibroid can be free to move around on its stalk, causing symptoms of pain and discomfort. Women will come to the office saying they can feel a mass or a firm, hard lump causing bladder or rectal pressure. Some unusual fibroid symptoms are breathing difficulties, because large fibroids can grow to sizes that fill the upper abdominal area, causing breathing difficulties. Kidney failure is another unusual one. Your ureters transport urine from the kidneys to the bladder, which is located deep in the pelvis, to the front of the uterus. If left untreated, fibroids can cause obstructive kidney failure if they are large enough to compress the ureters. This can lead to acute urinary retention and post-renal nephropathy. Kidney blockage is also rare, but can happen after a large fibroid compresses one or both of your ureters, causing a condition called hydronephrosis, where the kidney becomes swollen due to the backup of urine. Question number 3. What is the best way to know if I have fibroids? Pelvic exams and pelvic ultrasounds are the easiest and most affordable ways to detect fibroids. So routine GYN exams are the perfect opportunity to diagnose them. MRI or magnetic resonance imaging may be used in some cases to get a more precise picture of your fibroids. This can detect other abnormal pelvic conditions better than the ultrasound does and help guide decisions about surgery. Laparoscopy can be used to explore the pelvis and visualize fibroids when there are pain symptoms and exams and testing are inconclusive. Question number 4. What treatment options are there for fibroids, and is surgery my only option? Non-surgical treatments are a good option for women who have small fibroids and fewer symptoms. Some women may want a more conservative approach or have risks that may impact the outcome of surgery. But there's no guarantee that non-surgical options will work for you. Women with fibroids can successfully manage fibroid symptoms with anti-inflammatories, hormonal contraceptives such as the pill or injections, IUDs, hormonal IUDs, and medications such as tranexamic acid, which is a fibrinolytic agent that reduces bleeding by breaking down the blood clots, and that's used to manage symptoms. Each of these need to be considered based on your individual situation, family history, and medical risk factors. Uterine fibroid embolization, or UFE, is another non-surgical option. It is not for everyone, but it has been a viable, minimally invasive treatment option to shrink fibroids since the 1990s. Basically, a catheter is inserted into a vein in your arm or your groin, depending on the specialist, and this catheter is guided to access the uterus and the blood vessels that supply fibroids. A substance is injected into the catheter to block the blood flow to the fibroids. The procedure is performed under fluoroscopy, which uses dye and x-rays to guide the catheter. UFE, or fibroid embolization, can significantly improve symptoms like pelvic pain, heavy menstrual bleeding, and urinary problems. UFE can be a primary treatment for uterine fibroids and is a lot more affordable for many women. Depending on your age at the time of the procedure and other important factors such as the size, location, and number of fibroids, you may, however, need to have a later surgery for additional symptom relief. Studies vary, but an average of 10% of women may proceed to surgery because they are not satisfied with the results of the UFE procedure. UFE can certainly provide sustained improvement in quality of life for many women globally. The recovery time is reduced to under 2 weeks compared to the 6 to 8 weeks recovery after abdominal surgery. Women do experience a varying amount of pelvic pain, pelvic pressure, fever, chills, and fatigue after the procedure, which is why you'll often be prescribed pain medications, nausea meds, and antibiotics to take during recovery. UFE complications are rare and usually non-fatal. Some complications are associated with the risk of the fluoroscopy procedure, infection, ischemic complications, meaning that due to the restricted blood flow, there might be some risks associated with lower blood flow to the uterus, and then thromboembolic events or blood clots can happen. Thrombophlebitis also, which is inflammation in the vein. Radiation is used for the procedure, and there might be some adverse medication reactions. So if you are considering this option, this should be discussed further with your healthcare professional. Question number 4. What if surgery is my only option? Myomectomy versus hysterectomy. Surgery might be necessary if your fibroids are very large, causing significantly heavy menstrual bleeding, pelvic pain, bladder pressure, bladder incontinence, painful sex. I told you the list was long. Difficulty getting pregnant, miscarriages, or if other non-surgical treatments have not worked. Avoiding fibroid surgery can negatively impact your quality of life and severely affect your ability to have children in the future. A myomectomy might be recommended to remove the fibroids while preserving the uterus for pregnancy. A hysterectomy removes the entire uterus and should be considered when a woman does not plan to have children or if the fibroids are very large and numerous. When deciding on surgery, I often suggest that you consider how much are the fibroids impacting your daily life. Do you want to have children or not? You should have a clear understanding of the risk versus the benefits of surgery and the recovery process after surgery. Some surgery must-knows include the fact that the expected blood loss can be double or triple that of a hysterectomy when you have a myomectomy. So the myomectomy does pose a higher risk of excessive bleeding, excessive blood loss. If you desire pregnancy, you should have a myomectomy. It is advised to wait at least 1 year before conceiving. Some fertility centers may start treatments within 6 months after surgery with successful outcomes. Cesarean delivery is commonly indicated for delivery of pregnancies in women who have conceived after myomectomy, especially if multiple or large fibroids were removed from the wall of the uterus. Fibroids return. So, for women who desire pregnancy, there's often a specific window of time when it is best to pursue pregnancy before new fibroids regrow. Most studies suggest trying to achieve a pregnancy within a 5-year window after myomectomy. Otherwise, myomectomy and hysterectomy are similar in terms of the cost, anesthesia, surgical risk, and the recovery process. Women who opt for hysterectomy can retain their ovaries, barring any additional concerns, which means that they will experience a more natural onset of menopause and retain the benefits of normal ovarian function until then. So those are our 4 questions that I felt important to highlight in today's video. Well, guys, this is going so well. There's just so much I want to let you all know about fibroids. I think we should have a part 2. So please post all your comments, questions, and suggestions below this video, and we will answer those in Fibroids Part 2 of a monthly series, You Ask Doc About. Next episode, maybe we will address nutrition and lifestyle changes, as well as supplements and plant-based remedies that can improve fibroid symptoms. Before this video ends, subscribe to our channel and don't forget to like and share it with your friends and family. Thank you for your time. Stay blessed. If you want more info about fibroids or you need some help with your decision process, feel free to book an online consultation with me. It's quite easy to do so via our website. You'll find all of our information linked in the description below. Looking forward to chatting with you. Take care.